If you've ever answered an NCLEX practice question about DKA or HHS, otherwise known as diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome, and felt sure that you got it correct and you got it wrong, then this video is a game changer. Today, I'm walking you through real NCLEX style questions that even helped me, an experienced nursing tutor with over 16 years experience, finally connect the dots between the importance of fluid resuscitation, insulin administration, and the whole metabolic chaos that is happening when DKA and HHS occur. And once you understand these questions the way I do, you can stop memorizing symptoms and stop memorizing nursing actions, because what you do and why you do it will become common sense for you on these topics. Let's get started. I am not kidding when I say that when you study with the Silver Bullet study system, you only need to learn this stuff once and you will not forget it. Retention problems are a thing of the past. And diabetic ketoacidosis versus hyperosmolar hyperglycemic state is no different. It's just an extension of diabetes type 1 and an extension of diabetes type 2. It's a complication that happens when both disorders go to their extreme. Question number 1. I got this one wrong the first time I answered it, and I learned something valuable from it that I will never forget. I tell you this because I want to encourage you and make sure you understand that even nurses with over 16 years of professional nursing tutor experience don't always get NCLEX practice questions correct. They are hard for a reason. And because of that, you need to treat them like a learning opportunity in your study time and not just like a test question. A client with type 1 diabetes presents to the emergency department with signs and symptoms of diabetic ketoacidosis, DKA. Once intravenous access has been established, which of the following is the priority nursing intervention? Let's look at the answer options. Administer IV insulin is A. B is monitor blood glucose levels every hour. C, initiate cardiac monitoring. Or D, begin IV fluid resuscitation. Let's go through the answer choices one at a time. A, administer IV insulin. This is the best distractor. This is the one I incorrectly chose when I went through the answer choices. The reason is because when I looked at this and I said DKA, the first thing I think of is high blood sugar. And if we can correct that high blood sugar, we're going to correct a lot of other problems too, because that is the root cause. That is the pathophysiology that is causing diabetic ketoacidosis. However, the priority nursing intervention, and this is what I learned, is not to correct the root cause. It's to correct one of the symptoms, one of the things that happened because of the root cause that is probably going to kill your patient faster than the root cause will directly. And we'll get to that in one of the other answer choices. But when I do this the first time, we say administer IV insulin. That sounds good. That is something we will definitely do for DKA. We can hold on to this for a moment unless we get something better. B, monitor blood glucose levels every hour. Assessment is good, but not when your patient is dying. Therefore, we want to cross this out. C, initiate cardiac monitoring. If you overthink this question, this could be a tempting answer because diabetic ketoacidosis can lead to metabolic acidosis. Acidosis can lead to potassium imbalances. Potassium imbalances can lead to dysrhythmias, hence the need for cardiac monitoring. However, that's way down the road and is not going to be our priority nursing intervention. If we can only do one thing and then we have to go home, it's not going to be initiate cardiac monitoring and hope for the best. D, begin IV fluid resuscitation. When I got this question wrong, it was between A and D, but I thought A, let's deal with the root cause. Once I got it wrong, I wanted to understand why. The reason IV fluid resuscitation is the priority nursing intervention, even before we start administering IV insulin, is because somebody with DKA is more likely to die from dehydration at this point and circulatory collapse. Remember the 3 Ps of type 1 diabetes: polyuria, polydipsia, and polyphagia. Too much peeing, excessive thirst, excessive hunger. The polyuria and the polydipsia are the 2 that we're concerned about here. The body is trying to get rid of all that extra blood glucose because in your blood, we have so much stuff compared to the amount of water. It's normally supposed to have one balance to maintain homeostasis. That balance has been way thrown off. Therefore, the priority is to get more fluid in those blood vessels to dilute all that blood sugar. Not only is that going to have the effect of decreasing the blood sugar, but it's going to address the dehydration that's happening because the blood sugar has been so high. And that's going to relieve a lot of the more serious symptoms. Now, as soon as that IV fluid resuscitation has started, believe me, we are administering insulin at that point. But the fluid resuscitation comes first, and now you know why. Question number 2. A client with type 2 diabetes is admitted to the hospital with a blood glucose level of 600 milligrams per deciliter. The client is diagnosed with hyperosmolar hyperglycemic state, HHS. Which priority intervention should the nurse anticipate? This is rather similar to question 1, except this time it's with HHS. Let's look at the answer choices. Option A, administer intravenous regular insulin. This is like deja vu, isn't it? We like this answer. We know the blood sugar is high. We can see that in the question. Insulin is something we are going to do at some point. Is it the priority? Let's find out. We're going to keep this for the moment. B, start an intravenous infusion of 0.9% normal saline. This is another way of saying fluid resuscitation. And guess what? Because now we understand why this is important for DKA, we have to ask ourselves here, is this also going to be important for HHS? And the answer is yes, because the pathophysiology of what is going on is very, very similar in that we have way too much blood sugar in the blood, which means that the ratio of stuff to fluid in the blood has been thrown off. And with HHS, we are just as much at risk of dehydration as with DKA. Therefore, what we want to do is to do the fluid resuscitation. We want to dilute some of that excess blood glucose and prevent circulatory collapse. So between A and B, both good answers, both things we're going to do, but the best answer is going to be B between the two of them. C, because we always go through all answer options just in case there's something even better. C, administer sodium bicarbonate intravenously. Good distractor, because remember with DKA, we were concerned about metabolic acidosis. Well, this isn't DKA, so we're not quite as concerned, but it's still a possibility. And sodium bicarbonate would counteract that. See how your brain can start getting mixed up and you can start second guessing yourselves if we hadn't already clearly created a rationale for why intravenous infusion of normal saline would be the best answer. Even if metabolic acidosis was occurring, there's no point in treating it if we don't first address the dehydration. Therefore, C, we can throw out. D, provide the client with oral fluids. This is another good distractor because like our favorite answer so far, B, it is also going to address the dehydration. However, between an IV and between oral fluids, one works faster than the other. And this is an emergency situation when we have HHS. Therefore, oral fluids is not fast enough. We need to go with an IV infusion. If this was a less critical situation, then we would want to prioritize a less invasive intervention. However, with the seriousness of the complication, the IV is going to be the best choice. And the answer is B. Question 3. A nurse is caring for a client with diabetic ketoacidosis, DKA. Which of the following laboratory findings should the nurse expect to see? Answer A, blood glucose level of 50 milligrams per deciliter. We can delete this, right? Because DKA, if we know the pathophysiology, we know that that means that the insulin is not moving the blood glucose into the cells. Therefore, the blood glucose has spiked up a lot. 50 milligrams per deciliter is less than normal blood sugar levels that we would expect. This represents hypoglycemia, which is the opposite. Therefore, we can cross it out. Option B, serum bicarbonate level of 28 milliequivalents per liter. Now, on NCLEX NGN, they will always tell you the normal ranges for any lab result that they give you. However, not all nursing schools are doing that, which is why as a tutor, I think it's a good idea to still memorize your normal ranges. It doesn't hurt anything. The range I have memorized for bicarbonate is 22 to 26. This is a little bit on the high side, which is what we would expect if somebody was in acidosis, because DKA can lead to metabolic acidosis. This is a possibility for the answer option. C, blood pH of 7.30. This is clearly acidic. Normal blood pH is 7.35 to 7.45. And since we expect metabolic acidosis to develop with DKA, then we would expect the blood pH to be acidic. So we want to keep this. So B and C, okay, we'll talk about prioritizing those in a minute. D, urine specific gravity of 1.005. This is still in the normal range, which means we're back to deciding between B and C. If we need to prioritize which we're more likely to expect, I'm going to go with C. The reason is because I directly expect acidosis, and that is what this lab value shows. While yes, bicarbonate could increase as a result of the acidosis, that's not the first thing I'm going to expect to see. And if you want to get nitpicky, some labs, 28 would still be considered in the normal range. It a little bit depends on what range you memorized. which is also why NCLEX started giving the ranges on the tests. But the correct answer in this case is blood pH of 7.3 because it does directly tie to what we would expect first with diabetic ketoacidosis complications. Question 4. A nurse is assessing a client with hyperosmolar hyperglycemic state, HHS. Which of the following clinical manifestations should the nurse expect to find? A. Kussmaul respirations. B. Blood glucose level of 600 milligrams per deciliter. 6. Presence of ketones in urine. Or D. Fruity breath odor. This question is a perfect example of how you can easily mix things up when you are trying to memorize symptoms instead of understand them. Let's look at Kussmaul respirations. What are they and why do they happen? Kussmaul respirations is a form of hyperventilation. It often happens in response to metabolic acidosis. That's because the respiratory system responds to the metabolic acidosis by trying to blow off acid. And you do that with the breathing fast or the hyperventilation. However, metabolic acidosis is a lot less common with HHS than it is with DKA. Kussmaul respirations is more closely associated with DKA than HHS, so we can cross this out. B, blood glucose level of 600 milligrams per deciliter. This absolutely could be a manifestation of the HHS because it represents a very high blood glucose level. In fact, I believe the definition of HHS is 600 milligrams per deciliter blood sugar or higher. This looks like a good answer, but let's review the rest. C, presence of ketones in urine. This is definitely associated with DKA and not HHS, and the reason is in the name. Diabetic ketoacidosis. With diabetic ketoacidosis, the body cannot get blood sugar into the cells because there's no insulin. Therefore, the body needs an alternate form of energy, and it does this by breaking down fat. One of the waste products of this process is ketones, which then need to be cleaned out of the body by the kidneys and end up in the urine. This is not associated with HHS. We can cross it out. D, fruity breath odor. This one is kind of silly sounding. And this happens because ketones, when they are broken down in the body, break down into acetone. And acetone has a somewhat fruity scent. And because somebody in DKA has so much of it, it can come through and you can smell it in their breath. But that is DKA, not HHS, which means that our best answer here is B, blood glucose level of 600 milligrams per deciliter. Question 5. A nurse is planning care for a client with diabetic ketoacidosis, DKA. Which of the following outcomes is the priority for this client? Whenever you have a priority question, it means we might have more than one correct answer, but there's only one correct answer that is the priority. A, the client maintains adequate nutritional intake. B, the client regains normal fluid volume. C, the client reports an absence of pain. Or D, the client demonstrates understanding of diabetes management. As you can see, we want all of these things to be true for our patient. But which is the priority for somebody with DKA? A, do we want them to maintain adequate nutritional intake? Of course, that's important. And because they're in DKA, they are not able to get the blood glucose into the cells to get their energy that they need. So this is a concern. Is it the most immediate concern? Usually, nutritional things are not that urgent. It takes a while to starve, so we can usually take a little time to fix that. But we'll hold on to it for a minute until we find something better. B, the client regains normal fluid volume. This should ring a bell from the first two questions. What's most likely to kill them first? The fluid volume depletion. The dehydration that's happening because there's so much more stuff, glucose in the blood, than water compared to the normal ratios. Therefore, this is sounding pretty good because it's definitely the first thing we're going to take care of when we are prioritizing our nursing care. I'm going to cross out nutritional intake and go with B. Let's look at the other two answers. C, the client reports an absence of pain. That's for anybody. There's nothing specific about diabetic ketoacidosis that pain would be an issue for. And D, the client demonstrates understanding of diabetes management. That's an educational goal that is going to be important after the immediate critical complications are taken care of. So we can cross that out and go with answer B. Now that DKA and HHS finally make some sense to you, let's take it a step further because the next 5 questions I'm walking you through are all about type 2 diabetes. You'll see exactly how to apply these same think like a nurse strategies to different types of scenarios, and you might be surprised by what's actually a priority. Head on over to this video over here, and I'll meet you there. Before you go, tell me what your score was in the comments. Did you get them all right, or did you get some wrong?